You sit down at the kitchen table with your morning cup of coffee, looking forward to a quiet, peaceful start to your day. You take a sip, but as you try to swallow, that familiar, stubborn lump catches in the back of your throat, forcing you to clear your throat loudly just to clear the airway. You clear it again, and then once more. But the sticky, heavy sensation remains completely unmoved, casting a shadow over what should have been a relaxing morning. It is an incredibly frustrating, circular routine that hundreds of thousands of people over the age of 60 endure every single day, turning an ordinary morning into an uncomfortable battle with an invisible irritation that just will not go away. When you mention this constant throat clearing during a routine medical visit, it is easy to get a quick prescription for an allergy pill or a simple recommendation to drink more water. Mainstream medicine is wonderful at treating acute infections and major respiratory crises, but our heavily burdened healthcare system rarely has the luxury of time to investigate the slow, chronic disruptions that quietly wear down our quality of life. Your physician is not ignoring your discomfort. They are simply navigating a fast-paced environment that forces them to focus on immediate, high-priority medical threats, rather than the subtle, underlying imbalances causing this persistent fluid buildup. There is a wide, frustrating gap between standard prescription guidelines and the deep, metabolic root causes that explain why your body is suddenly overproducing fluid in the first place. My name is Dr. Evan Noris, and I have spent the last 25 years focusing on geriatric physiology and metabolic health. I felt compelled to create this video after watching my own uncle constantly clear his throat during family dinners, a habit that deeply embarrassed him and eventually made him withdraw from social gatherings entirely. As we move past our 6th decade, the internal lining of our throat and digestive tract undergoes a profound biochemical shift because the protective mucosal barriers become less resilient and our digestive transit naturally begins to slow down. Think of your throat lining like a delicate piece of silk that requires a perfect balance of moisture to keep particles moving smoothly down into the stomach. When that balance is disrupted, your body treats the dryness or irritation as a localized emergency, triggering an overcompensated flood of thick, sticky fluid to protect the sensitive tissue. Because our natural swallowing reflex weakens slightly with age, this dense fluid pool stagnates at the back of the throat, turning into a constant, heavy weight that alters your voice, interrupts your sleep, and makes swallowing feel like an uphill battle. Before we unpack the biological reasons behind this stubborn fluid cycle, I want to understand your personal experience. So please, take a quick second right now to type either day or night in the comments below to let me know when your throat clearing bothers you the most. The first major culprit behind this constant throat irritation is a hidden process known as silent reflux, where stomach enzymes quietly travel up the esophagus without ever causing the classic, burning sensation of standard heartburn. Physiologically, the lower esophageal sphincter acts like a tightly sealed valve, designed to keep digestive fluid safely locked away in your stomach. As the years pass, this muscular valve can lose its tone, allowing microscopic droplets of pepsin and acid to mist upward into the sensitive tissues of your vocal cords during the night. Because these upper airway tissues lack the robust protective lining of the stomach, even a tiny amount of this digestive mist causes a form of microscopic chemical irritation that your body desperately tries to dilute by producing a thick blanket of protective fluid. A patient of mine named Gordon, a dedicated choir director who took immense pride in leading his local community singers every week, came to my clinic deeply distressed because his speaking voice had become raspy and unpredictable. He felt a constant need to clear his throat before every rehearsal, which filled him with anxiety and made him fear his musical days were coming to an end. Our clinical assessment revealed that his issue was not an allergy at all, but rather this silent upward movement of digestive enzymes occurring while he slept. We focused on simple structural adjustments, including raising the head of his bed by 6 inches and ending his evening meals a full 3 hours before lying down, which immediately prevented the digestive mist from reaching his throat. Within a month, Gordon reported that the heavy sensation had lifted completely, allowing his rich, clear singing voice to return without the constant need to clear his airway. If you experience a raspy voice or heavy fluid first thing in the morning, focusing on your evening digestive timing and elevating your torso can provide massive drug-free relief. Another highly prevalent yet overlooked cause of chronic throat fluid in mature adults is a distinct physiological change called senile rhinorrhea, which is essentially a chronic, non-allergic drip from the back of the nasal passages. This condition occurs because the autonomic nervous system, which controls the moisture levels and blood flow within your nasal cavities, can become slightly imbalanced as we age, leading to overactive fluid production. Instead of the nasal lining maintaining a thin, watery shield to humidify the air you breathe, the glands begin secreting a much thicker, unyielding fluid that slowly trickles down the back of the throat. Because the natural cilia, the microscopic hair-like structures responsible for sweeping fluids down your airway, become less active over time, this fluid pools right above your vocal cords, creating an unshakable urge to cough or swallow. A lovely woman named Martha, who looked forward to her weekly book club meetings and afternoon walks with friends, found herself avoiding conversations because she felt she was constantly interrupting others with an unpleasant, raspy cough. She had tried multiple over-the-counter allergy sprays with zero success because her issue was rooted in an autonomic tissue imbalance rather than a seasonal allergy response. We addressed her discomfort by introducing a gentle, non-medicated warm saline nasal rinse every evening, which effectively thinned out the heavy nasal fluids and cleared the nasal passages before she went to bed. Martha noticed a profound difference within just 2 weeks, finding that she could sit through an entire 2-hour book discussion completely free from that nagging, tickling sensation in her throat. To manage this specific type of fluid buildup, implementing a regular warm saline rinse or using a bedroom humidifier can help soothe the nasal lining and prevent that heavy overnight drip from settling in your throat. The third significant factor driving this continuous throat irritation is a subtle, age-related decline in salivary gland output, which paradoxically leads to the sensation of having too much thick fluid in your airway. It sounds contradictory, but your body requires a steady stream of thin, watery saliva to constantly wash away normal respiratory debris and keep the throat tissue perfectly lubricated. As we cross into our 60s, the total volume of watery saliva our glands produce naturally drops, leaving behind a much more concentrated, protein-dense fluid that clings aggressively to the back of the tongue and throat. Because there is not enough thin liquid to flush this sticky substance down into the esophagus, it hardens into a persistent film that feels exactly like a foreign object lodged in your airway, triggering an endless cycle of throat clearing that only increases local inflammation. A gentleman named Arthur, who loved spending his weekends restoring vintage wooden furniture in his workshop, found himself constantly spitting and coughing because his throat felt incredibly sticky and congested under the workshop lights. He assumed the wood dust was causing a massive allergic reaction, but a closer look showed that his throat was simply parched, causing his body to overcompensate by creating a dense, sticky mucus shield. We worked on a strategy to naturally stimulate his watery salivary glands by having him sip warm water infused with a squeeze of fresh lemon juice throughout the day, while also utilizing a natural xylitol rinse to encourage healthy hydration. Arthur was amazed to find that by focusing on increasing his thin saliva production, the heavy, sticky lump in his throat dissolved entirely, allowing him to enjoy his woodworking hobby in complete comfort. You can break this sticky cycle yourself by ensuring you are drinking warm, hydrating liquids consistently, which coaxes your body into producing the thin fluid necessary to sweep away the heavy buildup. Since we are right in the middle of our clinical breakdown and covering some deeply important physiological concepts, please take a quick second to type the word "present" in the comments section below, so I know you are still following along and taking control of your health. Our fourth major area of concern involves the widespread use of common cardiovascular medications, specifically a class of blood pressure drugs known as ACE inhibitors, which can quietly cause a chronic buildup of fluid in the upper airway. These medications work beautifully to protect your heart by relaxing your blood vessels, but they also prevent the body from breaking down a natural inflammatory substance called bradykinin. When bradykinin accumulates in the delicate tissues of the respiratory tract, it alters local nerve sensitivity and triggers a localized fluid response, leaving many patients with a constant dry tickle and a thick pool of fluid that no amount of coughing can seem to clear. Because this side effect can develop months or even years after you first start taking the medication, many adults never connect their throat irritation to their daily heart pill, leading to a long and unnecessary search for dietary or environmental causes. A former school administrator named Eleanor noticed that she was increasingly losing her breath during her evening phone calls with her grandchildren because her throat felt persistently choked with a thick, sticky fluid. She had spent a small fortune on throat lozenges and herbal teas, but the heavy congestion remained unchanged because the chemical trigger was operating continuously from inside her circulatory system. After reviewing her medication list, we identified her long-standing blood pressure pill as the hidden source of her airway inflammation, and I advised her to have an open discussion with her cardiologist about trying an alternative class of medication. Her doctor safely transitioned her to a different blood pressure support option, and within 3 weeks, Eleanor's chronic throat fluid vanished completely, allowing her to speak clearly and comfortably on the phone for as long as she wished. If you are taking regular cardiovascular medications and deal with a non-stop, stubborn throat tickle, it is incredibly valuable to have a conversation with your prescribing physician to see if your prescription might be playing a hidden role in your discomfort. The fifth and final piece of this puzzle centers around the gradual loss of muscle tone within the pharyngeal wall, the very structure that coordinates our ability to swallow cleanly and efficiently. As part of the natural aging process, the intricate web of muscles responsible for squeezing food, liquids, and normal respiratory secretions down into the esophagus can lose a fraction of their strength and coordination. This minor muscle weakness means that instead of every swallow acting like a clean, powerful sweep that empties the throat, small amounts of everyday fluids are left behind, sticking to the tissues and pooling in the small recesses of the airway. The presence of this stagnant fluid sends a false signal to your brain that something is stuck, prompting you to clear your throat aggressively, an action that unfortunately slaps the vocal cords together and creates further swelling, which generates even more fluid. A grandfather named Raymond, who cherished his family weekend breakfasts, started finding it difficult to enjoy his meals because he felt like he had to clear his throat after every single bite of food just to breathe comfortably. He was deeply worried that his throat was narrowing, but our clinical evaluation showed that his swallowing muscles simply needed a bit of targeted conditioning to regain their natural coordination. We implemented a simple daily routine of specific, gentle swallowing exercises, such as the supraglottic swallow technique and purposeful chin tuck maneuvers, which strengthened the pharyngeal walls and restored a clean clearance pattern. Raymond practiced these simple movements for a few minutes each morning, and he quickly found that his meals became effortless again, completely eliminating the embarrassing need to clear his throat at the dining table. You can protect the strength of your airway muscles by practicing mindful swallowing habits, sitting completely upright during meals, and performing simple daily vocal and throat exercises to keep those essential muscles strong and coordinated. To weave all of these clinical insights into a practical action plan you can easily start utilizing tonight, I want you to shift your focus away from temporary fixes like lozenges and begin addressing the true physiological triggers. Starting this evening, make a firm commitment to close the kitchen cabinets at least 3 hours before your head hits the pillow, giving your stomach ample time to empty and preventing any silent digestive mist from irritating your throat overnight. When you go to bed, ensure your head and upper chest are slightly elevated using a supportive wedge pillow, which uses the natural power of gravity to keep fluids exactly where they belong. Tomorrow morning, bypass the ice-cold beverages and instead begin your day with a comforting mug of warm water mixed with a small squeeze of fresh lemon, which actively helps thin out heavy oral secretions and stimulates your natural hydrating glands. Combine this with a gentle saline nasal rinse before bed to stop any overnight nasal drip, and perform 3 or 4 deep, intentional swallows while tucking your chin to keep your airway muscles strong. By staying completely consistent with these simple, targeted habits, you will give your throat tissues the perfect environment to heal, completely breaking the frustrating cycle of constant throat clearing within just a few short weeks. Please always keep in mind that while these dietary and lifestyle adjustments are firmly rooted in sound physiological science and extensive clinical observation, they are meant to support, never replace, the individualized medical care of your personal healthcare provider. I strongly encourage you to take these insights into your next medical appointment, using this information to have a thoroughly open, collaborative conversation with your doctor to ensure your throat comfort is fully addressed as a team. If you are eager to learn how another simple adjustment to your daily routine can dramatically improve your vitality and well-being as you age. Be sure to join us for our very next discussion, where we will uncover the surprising connection between your evening hydration habits and the deep, restorative quality of your night's sleep.